This is my presentation on radiation therapy and the benefits of volumetric modulated arc therapy, or VMAT. So to set the stage, it's important to talk about the relevance of medical physics. Medical physics are important. They contribute a lot to the field of radiation oncology and cancer treatment. They work with medical equipment for radiation therapy, making sure that the patients are receiving safe and accurate doses of radiation during their therapy. And they are also responsible for developing and implementing new technologies such as imaging and radiation therapy systems, which improve the quality of patient care. So to set the stage before we get into some of those radiation technologies, it's important to discuss how radiation actually works to kill off cancer cells. So radiation in this sense are X-rays or gamma rays that produce ionizing radiation, which will remove a tightly bound electron from the atoms or molecules, thereby damaging the DNA within the cancer cells. And when that DNA is damaged, they can't repair themselves, and the cancer eventually dies off over time. One of the radiation techniques that are used to do this are by accelerating photons. Photons are, in this sense, X-rays or gamma rays. They're neutral particles that pass deep into the tissue and then exit on the other side. They are delivered using a linear accelerator, and that diagram on the left is kind of showing how that linear accelerator works to accelerate the proton or the photons. It uses electric and magnetic fields to focus and steer the high energy electrons such that they strike a thin metal target that stops the electron beam, and some fraction of that electron energy is converted to a spray of photons. And the resulting photon beam then passes through a series of filters and beam shaping elements that flatten and define the edges of the beam. All of this is targeted at a tumor or spot in the body where the cancer is prevalent. The only issue is that this also damages a lot of healthy tissues. This is where the use of protons come into play. And when you accelerate protons, they also penetrate deep into tissues. They deposit most of their energy at a given depth. This is known as the Bragg peak. You can see on that diagram on the right that protons after a certain depth will deposit less energy at a drastic rate compared to conventional X-rays. This is why protons are very useful when accelerating for radiation treatment. That previous slide just shows how photons and protons, even at the atomic level, will interact. There are three main interactions. There is the photoelectric effect at low energy photons, where it just hits off an electron. There's the Compton effect, where there's a scattered proton or photon resulting from the interaction. And then there's pair production at even higher energies of photons, all of which reduce or produce radiation that will target and kill off the cancer cells. All of this is leading into the actual technology. It's important to use 3D conformal radiation therapy. This uses an MRI or CT to create a map of the body and tumor, and the radiation is directed from multiple areas, which increases the accuracy and precision, making sure we're just targeting the cancer cells rather than a lot of the healthy tissue. And those can be calculated with these equations, where the dose is calculated with some matrix multiplied by the weight of the beams to get a dosage amount, and then this cost function below it essentially evaluates how effective the treatment will be. The important terms to keep track of in this are the D sub I, which is the calculated radiation treatment plan subtracted by the actual treatment, and we want to keep that difference as small as possible to make sure that they're getting the treatment plan that is being calculated that'll target the cancer cells as best as possible. One type of this 3D conformal radiation technology is intensity modulated radiation therapy, or IMRT. It uses several arcs of radiation to target specific regions of the tumor. You can see in that diagram, there's a lot of beams coming into the body from different angles. This is just targeting the tumor so that as little healthy tissue is being hit as possible while conforming around that tumor from all these different angles. And the way they do this is through the use of a multi-leaf collimator. In this diagram, you can kind of see how the radiation beam is coming through this sort of set design, and the end result is the shadow down here. And you can imagine that as like a crudely shaped tumor. And you can change the collimator using the different leaves that are in there. You can move them in or out to change the shape of the radiation. This is a really great way to kind of shape the beam into a target for the tumor. And the leaves are often made of tungsten because the tungsten is a very dense metal. The radiation struggle to get through it. So the only radiation coming through is through the set designed hole that you make with the multi-leaf collimator. So with that, we'll get into volumetric modulated radiation therapy, or VMAT, which, unlike IMRT, is a continuous rotating arc of radiation, which provides less overall radiation and reduces patient treatment times. You can see in this diagram the difference between the IMRT and the VMAT. VMAT just uses one arc of radiation, rotates around the body to more conformably target the tumor, and it happens a lot faster. It's a lot easier to calculate than having several beams come in from different angles. It only requires the use of one collimator as you're rotating around the body. And it has been shown to actually improve patient results. There was a study of breast cancer using both technologies, and VMAT was shown to be superior in terms of conformity, sparing some of that healthy tissue, and reduced the treatment time overall. So VMAT is a much better option in terms of radiation treatment technology. And so that's kind of the conclusion there, is that VMAT is a little bit more effective. It does a better job of perfectly mapping that tumor that is being targeted, and should be implemented in the future. Here are my references.